Okay, so now we are going to look at parasympathetic and sympathetic effects on SA node, AV node, and what will effect on heart will be because of these sympathetic effects. So parasympathetic effect on the heart, it is rest system, a rest effect, eat, drink, and rest. Decreased heart rate will be there in the parasympathetic. Conduction velocity will be decreased through AV node. It will relax our body. That's why there is decreased heart rate, because our body does not need a lot of energy. So parasympathetic has effect of decreasing the heart strain. That's why it decreases heart rate, because our muscles don't need much blood. This is relaxing system. There is increased PR interval. So what happens when our body is at rest, our heart doesn't need to pump faster, and then it increases PR interval. So in this way parasympathetic increases PR interval. Now what happens in parasympathetic is, because of vagus nerve which decreases heart rate, increases the uh, width of PR interval. Effect of norepinephrine on heart, it increases SA node and it decreases PR interval, and increases SA node depolarization. It is effect of norepinephrine. Effect of norepinephrine increase AV conduction and decrease interval of heart rate and increase heart rate. Parasympathetic action of SA node is decrease heart rate, decrease sodium influx, vagal stimulation, myocardium, and myocardial vagal stimulation is there on the parasympathetic effect. Now, what happens in heart block? That heart conduction is blocked and it also increases width of PR interval. So another one is defective conductive tissue is artificial pacemaker placed in myocardium moderate band of the right ventricle, and because of defective conduction system. So this is the thing. And sympathetic effect increases heart rate and conduction, and norepinephrine acting on SA node and increase conduction velocity. Now what happens in absent P wave? When P wave is absent and normal QRS and T wave indicates pacemaker is in AV node. Now when there is absence of P wave, means in pacemaker is AV node because of certain abnormalities. Heart rate is it is a vignette when heart rate is 25, wide QRS complex, pacemaker is located in Purkinje fibers. Now it is, I will be describing, explaining this in my next video, that SA node act as primary pacemaker due to fastest impulse and the highest firing rate is of SA node. Sodium inward current performs SA conduction, and then another one is conduction in ventricle increase due to presence of Purkinje fibers. Highest conduction velocity found in Purkinje fibers, and it increases Purkinje fiber conduction velocity. Now what happens? Purkinje fibers has properties contributing to the highest speed of conduction. Its speed of conduction is highest in Purkinje fibers because its diameter is large and it increases conduction velocity. When large diameter is there, more conduction speed will be. So in this way Purkinje fibers are the highest speed of the conduction velocity. Purkinje fibers. Now Purkinje fibers are fast-paced fibers, specialized cardiac muscles, a larger diameter, and in highest speed of the Purkinje fibers. Now what happens? Pacemaker rate is SA node is greater than AV node. AV node is greater than bundle of His and Purkinje ventricle. This is rate of pacemaker, which is highest in SA node. But the fastest conduction fibers is Purkinje fibers. Speed is fastest in Purkinje fibers and the slowest in AV node. So this is thing which you have to keep in your mind while memorizing the conduction velocity of the heart. Now SA node is located in subendocardium of upper portion of the crista terminalis. upper portion of crista terminalis located in the superior part of crista terminalis, which is tissue in upper circle terminalis beneath crista terminalis. So this is anatomical landmark of SA node. AV node is located in the endocardium of the posterior part of internal arterial interatrial septum. And fastest fiber, as I already mentioned, are Purkinje fibers, larger diameter. These are fastest fibers, while pacemaker activity is more in SA node, but speed is more in Purkinje fibers. So SA node are for pacemaking and speed is highest in Purkinje fibers, slowest in AV node. In trained athletes, what happened? Cardiovascular adaptation has happened, which decreases heart rate, increase stroke volume, and cardiac output. This is very important thing, that in athletes, decreased heart rate is there, but stroke volume and cardiac output is increased in athletes. These are the key points which you have to keep in your mind. And then what happens? Stroke cardiac output is equal to stroke volume into heart rate. Increase the cardiac output will be due to physical activity, and there will be uh, correlation between these things.